It's finally time. COVID-19 vaccines are now available to everyone 12 and older. To find and schedule an appointment, go to vaccinelocator.doh.wa.gov. A message from the Washington State Department of Health. This vaccination update is being presented by the Washington State Department of Health. And joining us here on the hotlines, courtesy of the Washington State Department of Health, is Equity and Social Justice Consultant Fathiya Abdi. Fathiya, how are you this Wednesday afternoon here in June?
I am doing well. I'm super excited to be here and share space with you all.
Absolutely, and thank you for giving us a vaccination update. Look, we have a lot of concerned listeners, some that are still hesitant to get the vaccination. I know that vaccination rates are rising, especially here in King County, but can you give us the current vaccination rates in the state of Washington?
Yes, absolutely. As of May 31st, more than 7 million vaccine doses have been given out, and more than 3.3 million people in Washington are fully vaccinated. So we're definitely getting there, and those numbers are rising, and hopefully we'll be at a state where everyone is vaccinated.
I would definitely agree with that. I'm one of those 3.3 million. Now, I know that Governor Inslee, as like President Biden, is trying to get up to that 70% threshold by July 4th. Where are we in regards to that? And then talk about that versus the COVID-19 infection rates in Washington compared to the vaccination rates.
Yeah, so when I mentioned those more than 3.3 million people in Washington are fully vaccinated, that is nearly 54% of the population of 16 and older, and nearly 106,000 12 to 15-year-olds have received at least one dose as of May 30th. So we are getting there. Across the state, we've administered more than 86% of over 8.1 million doses delivered to Washington. So we're slowly but surely getting there.
And with Fathiya Abdi, Equity and Social Justice Consultant for the Washington State Department of Health, joining us here on GameTime Sports Talk. I'm curious though, with now those 12 and older. I have a teenager who got his first dose just a couple of weeks ago, and they're making, at least that age group is really leading the push to really end this pandemic. You have so many others that say, why should I get the vaccine when everybody else is? They're ending these mask mandates, and whether there's certain beliefs, whether it comes through social media and not believing it, whether they're anti-vaxxers or whatever the case may be. Tell us what you are doing with the Department of Health, the Washington State Department of Health, and getting those educated and those efforts to get those that have the vaccination hesitancy to get vaxxed up.
Yeah, I think it really just starts with communication, education, and outreach and how it's really delivered. So really looking at COVID-19 information, how is it delivered, who delivers it, and what exactly is delivered is key in really getting those populations the information that they need. For Department of Health right now, we're continuously working to ensure all communities have that access to COVID-19 information and ensuring that paper-based formats, that information is translated into those 36-plus languages. But I think one thing that's definitely been highlighted in these engagement efforts is that not a lot of people get information the best way, whether you translate it in paper-based formats, and really looking at other channels and formats to get that information out. So I'm talking videos and audio formats that people can just tune into to get that information. Whether you translate it into a different language, it definitely hits different if it's coming from audio format or videos for folks that may not know how to read in those said languages. Another gap that I think has definitely been highlighted during this COVID-19 pandemic is the lack of strong American Sign Language communication channels. And this was brought up by our disability partners, actually. So building that out, and currently we do house COVID-19 videos translated into those into that ASL language, but really looking at this even beyond COVID-19, how to ensure that everyone, regardless of language, regardless of disability, that they have the information that they need. So looking at those different formats. The other thing I definitely want to touch on is investing in community partners and leaders, and that is definitely something the Department of Health has been looking at, because information at the end of the day will be received differently depending on who delivers that information, right? And so some community-based organizations are able to really take that space and ensure that communication is coming from a community-based lens, ensure that it is resonating with community members, ensure that it is culturally and linguistically appropriate and accessible for their community members, and really hitting on the key information that folks really want. And one example, actually, that I'd love to share is the Washington Immigrant Solidarity Network developed this COVID-19 Know Your Rights vaccine information campaign, and really delivering that information in a way that gets at immigrant communities, specifically those that are undocumented, which tend to be missed in a lot of traditional outreach channels. And so really focusing on that particular population and delivering vaccine education information that also touches on immigration status, touches on the fear of deportation, touches on documentation, so people felt comfortable in accessing the vaccine without those fears being highlighted.
That's very interesting. We're talking with Fathiya Abdi, who is the Equity and Social Justice Consultant for the Washington State Department of Health. This vaccination update is being presented by the Washington State Department of Health. And you just touched on a few different things, because when the vaccine rollout began, there were concerns whether there were communities that had hesitancy or not. Those vaccines being available in certain communities versus others. And you talked about the distribution and vaccine access. And now with the mass vaccination sites being shut down, can you talk a little bit more about how the vaccinations are going to roll out, and which in particular are the different communities that that the state is most worried about getting vaccinated, that have not yet, those numbers have not yet sufficed as far as making sure that we have a fair distribution across the state?
Yeah, so those are great questions, by the way. So I'll touch on the first piece first. In terms of the mass sites actually shutting down, really taking a look at leveraging community pop-up clinics. So ensuring that communities have vaccine sites that they can go to, run by their community-based organizations or community partners and folks that are trusted and look like them, delivering that vaccine information and the vaccine. So essentially, the main focus there is bringing vaccines to people so that they don't have to seek it out. Mm-hmm. And actually, one thing that I wanted to share, and you've provided such a great segue for it, Department of Health just launched the Caravan, which is actually part of our pro-equity strategies to ensure equitable vaccine distribution for folks that are disproportionately impacted by COVID-19. And this really supports community partners that are hosting community events that would like to have a social gathering that may not be focused on COVID-19 vaccines, but would like a mobile van there to distribute vaccines. And so really pushing folks to have social gatherings that increase vaccine access. It's really designed to increase vaccine access for priority communities with an equity focus. And priorities will include counties with higher race of ethnicity gaps, more vulnerable or disproportionately impacted communities, sectors with recent outbreaks, or geographical locations without a caravan. So really taking the time to help support our community partners locally and getting vaccines out to their communities.
That's really interesting, especially with Juneteenth just a couple of weekends away. I think that's something that could definitely be an interesting vehicle with that. You know, especially in the African American community, we always look out for scams and frauds and fakes and different things of that nature. We want to know what is authentic and what isn't. Can you tell us, because we don't, I know that there has been some issues with scams and fake vaccinations being put out there. Tell me how you can differentiate the Washington State Department of Health. Is there a logo or something they should look for to make sure, so they know it's an official and not a scam trying to be ran as far as vaccinations being put out?
Yeah, so so definitely with Department of Health, there tends to be a logo and all of the things that they are promoting or producing. So we do have that DOH Caravan, But I also think states with folks locally with local public health jurisdictions, they are usually the ones partnering up with community partners and hosting these mobile vaccine sites. And so, if anything, if folks do have any questions about the authenticity of a mobile vaccination site, of a provider administrating vaccines, I would definitely check back in with your local public health jurisdiction to make sure that that is accurate if you do need that. I also think misinformation has definitely run rampant within all communities. I'm actually Somali, and so my mother depends heavily on WhatsApp, and there are a lot of misinformation that comes through WhatsApp. And so really depending on trustable resources like either on the Department of Health site or looking at local public health jurisdiction sites and seeing what COVID information, what community partners are hosting sites, and they tend to be reported by local public health jurisdictions and counties, and then also looking back at the CDC site to ensure that whatever information that you are hearing are myths or versus facts.
Absolutely. Fathiya Abdi, who Equity and Social Justice Consultant for the Washington State Department of Health, joining us here on Game Time Sports Talk. This vaccination update is being presented by the Washington State Department of Health. Before you give us any last news of note that you want to leave our listeners with, I'd have one more question in regards to the state reopening. Governor Inslee believes that can be done by June 30th. There has been some reports that may even get to a sooner date, maybe as soon as June 16th. Where are we at in regards to that, and how confident are you that by the end of this month here, whether it be 2 weeks or 4 weeks from today, that we are going to be able to hit that number and reopen the state?
So that is definitely, I can't give a definite answer for that,
okay.
Especially in that my work really centers community engagement efforts and vaccine access, and
Fair enough.
ensuring those that are disproportionately impacted have the information that they need. However, I'm sure there is an awesome team that can help answer that question that I can check back in with you via email and connect with that person.
That sounds great. Absolutely sounds great. And any last information or of course, a word of advice to those who are hesitant about getting the vaccine that you want to leave our listeners with?
Yeah, I definitely want to say that whatever hesitancy folks do have, they're coming from somewhere. And so they're to really ensure that you are being adamant about answering folks' questions, ensuring that they have the right information and education that to address those access barriers and proactively removing access barriers continuously. The other thing that I wanted to touch on is actually work that we do with the Vaccine Implementation Collaborative. And this launched in January with the purpose of convening a space, a meaningful space with community partners interested in vaccine implementation, outreach, and access, and intentionally prioritizing the needs or the feedback from communities that have been impacted by COVID-19. And that is just one space to receive real-time vaccine updates from COVID-19 leadership or subject matter experts, share successes and challenges, but most importantly, identify areas in which Department of Health can support efforts. And so I'm more than happy to connect with you via email as well to share a link to that information. But it is called the Vaccine Implementation Collaborative. If folks would like to just take part in a meaningful space that really addresses those vaccine hesitancy concerns.
Absolutely. We appreciate your time, Fathiya, and thank you for the information and all the work that you're doing in trying to get us out of this pandemic, one vaccination and one man or woman, or should we say teen or tween at a time. Fathiya Abdi, Equity and Social Justice Consultant for the Washington State Department of Health, we thank you for your time. I appreciate it. Stay safe, and we'll talk with you soon.